While we're working hard, setting up as many clinical trial options with psilocybin and then hopefully potentially other future psychedelic medications, it is possible for select patients, if appropriate, to obtain treatment for mental health or substance use disorders at the TRIP program in Santa Monica using ketamine in an off-label role as the psychedelic drug in psychedelic-assisted therapy. This is a treatment program that uses ketamine in an off-label capacity, which means that ketamine is not FDA approved for this purpose, but research studies have suggested that it can be done safely and may be helpful. And therefore, it's possible for doctors and patients to use a clinically available medication for other indications or conditions. Ketamine is approved as an anesthetic and is used during surgery at very high doses. Research has also found it to be helpful as a rapidly acting antidepressant. And the doses used to treat depression are much lower. They do not cause anesthesia. You may be familiar with ketamine treatment for depression. Many clinics have begun offering ketamine intravenous infusions to treat conditions like depression or chronic pain. The model that we're using, where ketamine is used within the context of a psychedelic-assisted psychotherapy program and is integrated and interacting with the psychotherapy, is quite different than the model used by these ketamine treatment programs. This is not to say that one model is better than the other. And some patients may do better with a strictly medical approach, and other patients may do better with the psychedelic-assisted therapy approach. But a ketamine infusion typically is provided to the patient without any associated counseling, and in many cases, the potential psychedelic effects of ketamine are considered a side effect. And in fact, many doctors and pharmaceutical companies have been working to try to figure out how to remove the potential psychedelic effects from the ketamine therapy. We, in turn, think that, in contrast, the psychedelic effects of ketamine may actually be how it works for depression, anxiety, drug or alcohol problems. So we hope to use the psychedelic-assisted model with ketamine as the psychedelic drug as a way to harness the potential effects of ketamine and extend and lengthen the therapeutic response. Because a major challenge with ketamine treatment, for example, for depression, is that although patients may have a robust and quickly acting antidepressant effect from a ketamine infusion, without any other subsequent treatment, that effect usually wears off in a matter of weeks. In turn, doctors have investigated giving additional ketamine infusions. But we'd like to avoid that. Ketamine is a controlled substance. There is a potential for addiction and abuse. There are potential medical consequences of chronic ketamine administration. Again, there may be patients who benefit from this, and there are clinicians who may be able to provide that strictly medical treatment safely. But it is different than the model that we're interested in. In that case, it's the medication being provided in isolation, and the effect is riding on the medical or pharmacologic effects of ketamine. Here, it is the counseling, the psychotherapy, the process that the patient is engaging in. And the psychedelic experience is used to accelerate and augment that process, to allow patients to make much more progress than they would if they were approaching the problem using standard psychotherapeutic approaches, where patients often begin to deal with difficult emotions, challenging issues within a counseling session. It may become upsetting or overwhelming, and then typically the approach would be to move away from that difficult emotion and then come back to it in a subsequent session. As a result, it may require many sessions over a long period of time to make progress. The psychedelic-assisted therapy approach is different in that in the psychedelic drug session, if challenging or difficult things come up, we encourage the patient to go towards that, to explore it, to investigate it with us at their side. And it appears that the drug effect provides a loosening of their inhibitions such that with the support of the clinician during the session, they may be able to approach, even address, and move beyond some of these challenges or blocks to become unstuck, which is often how patients describe themselves when they come to us seeking treatment after having tried existing first-line therapies and not had a total response. Again, as ketamine is an FDA-approved medication and clinically available, FDA-approved as an anesthetic, it is possible to use ketamine off-label within psychedelic-assisted therapy to treat a variety of mental health or substance use disorders, including depression, anxiety, PTSD, end-of-life distress, drug or alcohol problems. Ketamine is not currently approved for those indications, with the exception of a ketamine nasal spray called S-ketamine, which is approved to treat treatment-resistant depression. The mode of ketamine therapy that we are primarily using during psychedelic-assisted therapy with ketamine is an intramuscular injection of ketamine, and we prefer this at the moment because that may be the mode that's most likely to produce a psychedelic therapeutic effect. In addition, there are other ways of administering ketamine, including orally or under the tongue sublingually, or an intravenous infusion, or again as a nasal spray. We currently have openings to see patients to be evaluated for possible treatment with psychedelic-assisted therapy using ketamine. Patients who have depression, anxiety, PTSD, end-of-life existential distress, grief or bereavement, drug or alcohol problems could be candidates for off-label treatment with ketamine in our psychedelic-assisted therapy program. Patients are very reasonably concerned and often ask, will insurance cover psychedelic-assisted therapy? Because psychedelic-assisted therapy is not currently an approved method, and the medications are not FDA approved, typically insurance will not cover psychedelic-assisted therapy, and it may cost the patient out of pocket for the treatment. Some of the care given related to psychedelic-assisted therapy, including doctor's visits or standard counseling sessions, may be billable to insurance and are a very important part of the overall treatment plan. It depends on your insurance, and as always, we recommend you check with your insurance company to find out about coverage.